Once we've understood how a pregnancy happens naturally, we also need to understand how a pregnancy happens through an IVF cycle. In the IVF cycle, the purpose is to make as many eggs as possible to grow up all together, then take them outside the body at the right time, fertilize them outside and form embryos. Personally, I would prefer these embryos to be transferred in the next cycle when the hormones in the body are much lower and much more physiological. That means more like natural. But we can also transfer the embryos in the stimulated cycle itself. How do we prepare for an IVF cycle? What are the steps of the IVF cycle? What is the IVF cycle that I prefer? This is what the content of the discussion is today. Let us talk about the preparation of the IVF cycle. You should and your partner should be in the best of health. So make sure all your blood tests are done and they are all proper. Especially focus on the thyroid, the sugar levels and the other hormone levels, both for yourself and for your partner. Once the reports have been seen and confirmed as okay by the doctor, you start taking some antibiotics, some antioxidants and some prenatal vitamins. What it does is it makes sure that in case you have any deficiency of any of these things, it is made up by this antibiotics, antioxidants and vitamins. Especially in men, we say antibiotic is necessary because many a times their semen sample contains infection which may prevent good fertilization later on. Also, along with the blood test and medications, you have to remember to make sure that you undergo the financial counseling to understand the cost implications and the consents that have to be taken and signed. So financial counseling and the consent and the psychological counseling. So this constitutes the pre-IVF for you. Once you have started on all these medications, the reports are all right, that's when you are put on contraceptive pills. Now this is a very common question that people ask me. If you are going for a baby, why are you giving a contraceptive pill? Please understand, a contraceptive pill will prevent your brain or the hormones coming out of the brain from selecting the eggs present in the ovary. So what is happening is all the eggs in the ovaries are all there static. They are not growing up, are not being selected by the body. This helps us because when we withdraw the contraceptive pills and give a washout time of 4 or 5 days, when we start the injections thereafter, all the eggs that are available start growing all together. So then we have what is known as a concordant cohort, meaning all the eggs are of the same size right from the day one. If I were not to give a contraceptive pill, even then that's not a problem in major patients. But in some patients, the body might have already started selecting 1 or 2 of these eggs, and then when I start the injections, these 1 or 2 eggs are faster growing and the rest are lagging behind. This is known as a discordant cohort of follicles. Now what this does to us is, we have a problem trying to go the cycle either by the leading follicles or by the ones that are slow. Because if we decide the cycle on the basis of the leading follicles, then the rest are immature. But if we wait for the rest to grow up completely, then the leading couple of follicles might have become over mature and might have destructed themselves. So get the best harvest of follicles all together, we give you contraceptive pills. But this is to be understood in a lot of context otherwise also. If I give you contraceptive pills for a long duration, then the brain would stop functioning whatsoever, and then you'll require very high doses of FSH injection to make the eggs grow up, which is a waste of money. If I give you contraceptive pills for few days, then maybe the brain will not shut down and the follicle selection would still happen. So we need to give you the contraceptive pill at least for 10 or 12 days and maximum for 28 to 35 days. There is another role that we get to play when we give you contraceptive pills. So people who are working, who have a busy schedule, who are coming from outstation, for them it makes sense to plan the cycle with us immediately, because then we can decide, mutually decide actually, on which date to stop the pills and from which date to start the injections, so that you need not worry about taking leave and being absent from your work or finding tickets at the last moment, etc., etc. Only thing to remember about contraceptive pills is they have to be taken at the last thing in the night before going to bed, and these are very low dose pills, so they are not effective for more than 24 hours. Make sure that you take them at the same time every day, otherwise the effect may be lost. Once the contraceptive pills have been decided to be withdrawn, you'll have to give 4 days of no pills. So these are known as 4 pill free day. And then on the 5th day, if it's possible for you, come to the center so that we do an ultrasound, see if there are no leading follicles. All the follicles are of the same size, and that's when we start you on the FSH injection. In case you are not from town, then we'll have to take a chance and start your injections as it is on the 5th day of stopping pills. So this constitutes your first day of stimulation. The same amount of FSH injection has to be taken for the next 4 days. So for the first 5 days, the FSH injection has been taken at the same time every way. Either in the stomach, in the tummy, in the skin, we call it the subcut or the intra-fat injection, or in the forearm or in the thighs. Your nurse will teach you how to take the injection. These are very simple, don't even cause as much pain as an ant bite, and I would rather prefer that you inject yourself. Once these injections have been learnt and you started taking it yourself, you take it at the same time every day for first 5 days. The 6th day of injection, it is preferred that you come to us for an ultrasound. That's when we check whether any of the follicles that are now growing up have crossed 14 millimeter in size. Once they have touched 14 millimeters in size, now that could be on the 5th day of injection or 6th day or sometimes on the 7th day of injection also, we start giving you another injection called the antagonist injection. Now essentially what this antagonist will do is make sure that you do not ovulate before time. It will prevent LH surge, which will lead to ovulation. So now you are having 2 injections. The FSH injection as before and a new injection called the antagonist injection. Really speaking, both the injections could be taken at the same time or could be taken 2 hours, 3 hours apart, makes no difference. Once both these injections have started, that's when you know that your partner needs to abstain from sexual contact, and he might be called upon to give a semen sample any day now. Usually it takes 4 or 5 days of antagonist injection for the eggs or the follicles to be ready. We call you for an ultrasound almost on an alternate day basis. So you might be called for an ultrasound on the 7th day and the 9th day, or the 8th day and the 10th day. Once the eggs have reached a size of 17 millimeters, we will tell you that the eggs are now mature. Once the eggs are mature, on that same day you will have to take the antagonist, also the FSH injection, and along with that you'll have to take the ovulation trigger injection. Ovulation trigger is the single most important injection in the entire stimulation cycle. Make sure that you understand about the ovulation trigger in complete details from your nurse. Ideally speaking, we would like to give you this injection, but unfortunately in most couples it has to be taken in the dead of the night when we are not functioning. So then we have to trust you to be able to take this injection properly. And because mistakes can happen anytime from anybody, we need to call you the very next day to confirm whether this injection was taken properly or not. This is something that you have to grin and bear with us. This injection makes sure that the eggs finally mature and they can be taken out 35 hours later after giving this injection. This injection could either be a single shot or 2 pricks in your tummy, in the fat. Generally speaking, these injections are given when we have finally confirmed to you that the follicles are mature. Before giving this injection, make sure that your FSH shot and your antagonist shot has also been taken for the day. That is to understand that the day that you give the ovulation trigger, the other injections also need to be taken and they should not be stopped on that day. So on the day of ovulation trigger, you have taken your FSH injection and the antagonist injection as usual, and then you are planning to take the ovulation trigger as at the time given to you by your nurse. That injection has to be injected yourself in your tummy. The injections are very simple. Anybody who has seen how to inject these injections can do it himself or herself. Once these injections have been taken, they start creating an artificial LH surge which stays in the body for next 18 to 24 hours. So if we call you for a urine test next day after 12 to 14 hours, we can tell you from checking the urine whether you are having a LH surge or not, which means that you have taken the injections properly or not. This LH surge will lead to maturity of the follicles and the eggs inside the follicles. Giving the injection will make sure that all the eggs will mature together. "35 hours later, after we have given the injection, you will be put under anesthesia and the eggs would be extracted under ultrasound guidance with the help of a long needle. Don't worry, this is not painful. In fact, it's rather painless. It's like drawing the blood from your veins. But because we do it vaginally, because the position is a little awkward for you, we might have to give you some light anesthesia to knock you out. There are a lot of patients that I have who insist on getting the ovum pickup done without anesthesia, and we are very comfortable doing that for you. In case you want yours to be done without anesthesia, please mention that to me. Once the eggs have been taken out, and hardly takes 10 minutes, 5 to 10 minutes, you are finished as far as this month is concerned. Then our work starts. We take the egg and the sperms together, form embryos, comment on the status of the embryos to you. In the next couple of days, we are ready with a few embryos to transfer to your womb. Now, as we might have discussed already with you, we may transfer these embryos this very cycle or freeze them to be used in the next or the next cycle. There are a few questions that I get asked so many times by all of you. I will discuss these questions as well at this moment. You can go to office or work or do anything else that you are habituated to doing during this time. There is no need to stop any of your physical exercises that you are doing so far. You can have a normal sexual life with your partner, but stop having sexual life from the 5th or the 6th day of FSH injection, because then the sperms may be needed for the IVF or the ovum pickup day. Make sure that you do not start any new medication without informing us. And as far as other things are concerned, if you're taking some special medication for any other disease, etc., please make sure that you inform us that you're taking a particular medicine, and make sure that your doctor also knows that you are undergoing an IVF to get pregnant. These are very simple rules, but if you follow them properly, your chances will definitely increase. Yes, one more thing, diet. Please understand, diet doesn't make much of a difference, but a healthy diet is all that we advise you. It should be rich in proteins and less on carbohydrates. You should take adequate amount of liquids and stay away from liquor, alcohol, and maybe cigarettes as well. So to conclude, a cycle well begun is job half done. Make sure that you are in the best of spirits both mentally and physically before you start the cycle. Make sure that you have had a good round of discussions with your doctor. Make sure that you comply with all his advices, and you may raise your issues with your doctor at any time that you want to. This is your cycle, and you need to make sure that everything goes just right for you. All the best, and thank you for a patient hearing.